I call the member for Noosa.
Thank you, Mr Deputy Speaker. I rise to contribute to the Health and Other Legislation Amendment Bill 2018. It is clear that the bill intends to align previous legislation with current definitions and practices across a number of acts. The repeal of the Medicinal Cannabis Act 2016 is essential, following the rescheduling of the medicinal cannabis from a Schedule 9 substance, along with heroin and LSD, to Schedule 8, which incorporates other restricted substances with therapeutic use, such as morphine and fentanyl. This is a step in the right direction for those in our communities who seek legal access to this product. However, there are further improvements sought from Queenslanders, as outlined by the member for Maiwar, and is for another debate. The amendment to the Public Act 2005 to establish the notifiable dust lung disease register is in response to the recent cases of black lung and silicosis from those working with engineered stone. This is a welcome protective measure to ensure Queenslanders are working in safe conditions. There are a number of other amendments, including to the Transplantation and Anatomy Act 1979 and the Radiation Safety Act, which are all commendable, and previous speakers have spoken on the benefits of these, and I do not need to replicate. The final section of the bill are proposed amendments to the Retirement Villages Act 1999 with regard to setting concrete timeframes in which residents wishing to leave the facility can receive their exit entitlements. As outlined, there are two types of ownership afforded to residents of retirement villages: leasehold and freehold titles. Currently, residents in freehold agreements are not eligible for exit entitlements and are solely responsible for the sale of their unit should they wish to leave. Due to the limited control able to be exercised by a resident of a freehold unit in a retirement village, it is considered that they are in a similar position to a resident holding licence or leasehold tenure. The bill aims to address the current gap in protection for residents in freehold units and improve fairness by ensuring they have the same protection as residents with other tenure types, and is commendable. Mr Deputy Speaker, however, there has been concerns on a component of this that requires the operator to buy back the unit from the outgoing resident should it remain unsold after a period of 18 months. Though I support the intention of the legislation to ensure freehold owners receive exit payments in a timely manner, the concerns voiced that body corporate structures via residents would need to absorb these costs or may incur increased fees to mitigate the increased risk of financial loss needs to be addressed. Whilst I acknowledge the avenues provided by QCAT, as we know the stress that these processes take on our constituents, as well as the overloaded QCAT, needs to be considered. Mr Deputy Speaker, therefore, whilst I support the vast majority of proposed amendments in this bill and appreciate the assurances regarding the retirement villages provided by the Minister, the concerns regarding the potential financial implications to retirement village residents needs to be mitigated, and therefore support the member for Kawarna's amendment for Part 9 of this bill to be dealt with separately. Thank you.
I call the member for